So welcome everyone to our second webinar in our series for Integrity Week at the University of Calgary for 2020. Integrity Week runs this entire week from October 19th to 23rd. My name is Sarah Eden and I'll be your convener for today. I'm joined by Dr. Andrew Zito and Helen Pestrick, our webinar production coordinator. We'd like to start by acknowledging the traditional territories that we're joining you from today, the people of the Treaty 7 region of Southern Alberta, including the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. And we'd also like to acknowledge that the city of Calgary is home to the Métis Nation of Alberta, Region 3. Thank you again for joining us for today's webinar on academic integrity and mental health. I'm so pleased to be joined by my colleague, Dr. Andrew Zito, who's the Director of the Campus Mental Health Strategy for the University of Calgary. Please go ahead when you're ready, Dr. Zito.
So again, good afternoon. Thank you for joining me on this session. I am Andrew Zito. I am the Director of our Campus Mental Health Strategy at the University of Calgary. I am also an associate professor in the Department of Psychology. My area of research or expertise is in the stigma of mental illness. We do a lot of work with implementing and developing and evaluating mental health programming, and some of that programming we have on our campus. And more generally, since I've been the director of the Campus Mental Health Strategy, I have really been interested in post-secondary mental health. So mental health students, faculty, and staff, and looking at bigger picture things within the post-secondary world as well. So let's talk a little bit. So before we start, I want to go through some intro stuff, but the goal of today's talk are a couple, but really I think the main goal is to really explore this topic as there's very little research, and talking to Sarah and Helen, there's not that much research on this, and we're just saying that if this is mentioned, it's mentioned as kind of a side discussion and not really the topic of discussion. So what we're doing here is really increasing the academic discourse, and maybe as for future research as well. I also want to increase our awareness, understanding, and appreciation of the mental health impacts on academic integrity, and also looking at academic integrity and especially the processes and procedures that are involved and how that might impact mental health as well as of students and of instructors and those involved in the process. I also, again, this is where my expertise is more into, but understanding of mental health. And also, I think it's always important to talk about campus resources that we have on our campus, as we have many. And just to give you an overview of how we'll reach those goals, first I'll talk a little bit about mental health, and within the context of the mental health continuum model. This is a way of thinking about mental health, not the only way, but one of the ways that we talk about mental health on our campus and in our programming. And there's a lot of research behind that we've done that shows it's a good way of talking about mental health. Then I want to talk a little bit about the factors that impact mental health. So we have, some of the risk factors, or some of the factors such as related to biopsychosocial. Stress is an important thing, as well as our current situation. And I have the coronavirus picture there. So we're going to talk a little bit about that. And then that gives us a good background to really get into a discussion about how mental health and academic integrity are related and how they might feed off each other and impact each other. And then finally, we'll move on to the resources.
Dr. Z, I'm just going to interrupt here. We've had reports that the audio keeps fading in and out, and that might be a microphone issue.
And that could be, again, that I will sit a little bit closer and talk a little bit louder.
Thank you.
If that happens again. So poll number one, I just want to know a little bit about yourselves and which specific area you work in. If you can fill out that poll, that'd be great. And I do recognize some names here as well. Those who are I don't know if you can put in the chat so we understand where you're coming from. I did expect to see some student service professionals, those who might work within the process or with student services.
Yeah, we have people letting us know that they're coming in from Ontario and Regina and from Manitoba.
Oh, well, welcome, and thank you for coming into this presentation. Okay, so we can move on to our, actually it's another poll question. What are you most interested in learning from today's session? Okay, impact on, yeah, so these are the ones I actually filled this out, and those are the ones I picked as well. But again, there's everybody's here for different reasons, and hopefully we cover all these things. And if there are things that we don't cover, please let us know or let me know through your questions, and we can address them at the end as well. Okay, so let's talk a little bit of mental health. The reason why we talk about mental health is, again, I think to give everybody a basic understanding of mental health, and again, it will give you that primer, that baseline knowledge to understanding, how the impacts of mental health on academic integrity and vice versa. So just talk a little bit about mental health. How we define mental health, or how I define mental health, is similar to what I have on here: the capacity to think, feel, think, and act in ways that enhance one's ability to enjoy life and to deal with challenges. And when we think about mental health, we can break it down into a couple of things. Mental health, or good mental health, is when we feel emotionally and psychologically well. So when we say emotionally, it means we are feeling happy, for example. Psychologically, we're talking about having meaning in life, or having purpose. We're connected socially, so we know social connection and having that sense of community is so important for mental health. Ability to cope with difficulties, have the capacity to achieve our goals. So those are, a standard definition of mental health. And good mental health, or having mental health, does not mean the absence of a mental illness as well. So that's an important fact or thing that I like to bring up. But this is a traditional way of thinking about mental health, is that either you're healthy or you're ill. So it's a black or white thing. There's nothing in the middle. Once you are have diagnosed mental illness, or you're deemed mentally ill or whatever, then you stay there, right? So we know that's not necessarily the best way to think about mental health or conceptualize mental health. And one way that we've really worked on or thought about mental health is through the mental health continuum model. You may have heard of it. So programs such as the Working Mind, the Inquiring Mind for post-secondary students uses this model, and maybe some of you have taken this model, so that would be a refresher for those who have taken it. But I do really want to talk about this model because it's been useful in kind of rethinking of how we think about mental health and giving an easy framework to think about mental health. So it's a continuum that was developed by the Department of National Defense. And I mentioned these programs, the Working Mind, the Inquiring Mind program. But the essence of this mental health continuum model is that it moves from green, yellow, orange to red, right? Healthy, reacting, injured, ill, on a continuum. You see that healthy is you're functioning well, positive mental health, and you actually may be in recovery from a mental illness. Yellow is when we're experiencing common self-limiting everyday distress and nothing too major, always can get back to the green. Orange is when there is some functional impairment or impact, and in red, you may have a diagnosable mental illness, but the most important thing here is that there's a severe and persistent functional impairment. So whether it be attitudes or psychological functioning, social functioning, emotional functioning, there is severe impairment in some of those domains. I want to point to the bidirectional arrow. This is an important part of the continuum. So what it shows here is that, if you're in green, you move down to yellow or into orange. And if you don't get the resources or the self-care or whatever, you could move into the red. However, what the bidirectional arrow implies is that you can always move back to the green with the proper resources, whether that be counseling, professional resources, or with self-care as well. So again, that's a very important component of the continuum model. This is actually the full continuum. And what we've done here is to divide the continuum into 5 domains of everyday functioning. And so you can see that the continuum goes from green to read on mood, thinking attitudes, changes in behavior, performance, physical changes, as well as substance use. And I want to really highlight those two domains, as those two domains I think are very relevant to what we're talking about today. So as we move down the continuum, our mood and thinking attitudes are affected. You know, things that I like to point to are inability to concentrate, loss of memory, cognitive abilities, you're distracted. So those things might actually play into you know, some of the scenarios that we might talk about when we talk about academic integrity. It might be factors that increase academic or academic dishonesty, or any, you know, things like cheating or things like that. So again, this model is again quite useful in thinking about mental health, and it gives you a different way of thinking of mental health. It's a more holistic framework that talks about, again, various domains, emphasis on functioning across those domains as opposed to things like diagnostic symptoms or diagnostic criteria. I think we should move away from those things. I think mental health professionals, psychiatrists, psychologists, for sure, they should use that. But as individuals, I think we should really focus on functioning and things that we can see and feel rather than talking about specific criteria. This is a tool that we've used to you know, help individuals themselves, or a tool that others have used to support others. And this has been clearly shown in a lot of the research that we've done. You know, we've used this in the workplace, and others, you know, especially managers, for example, have used this to support their employees. Again, we can use this to support ourselves, support a colleague, or support students. And using the continuum, I think, confers another positive in reducing stigma. Continuum beliefs has been shown in the literature that it reduces stigma, or there's less stigma involved in thinking about mental health along continuum. As well, with the continuum model, we don't use stigmatizing labels, so we don't use things like depression or anxiety or schizophrenia or bipolar disorder. Those labels do confer stigma, and we don't use that within the continuum model. So again, this is a more holistic way, a different way of thinking of mental health, but I think a very useful way in thinking about mental health within what we're going to talk about. Does that make sense? Any questions?
No, we don't have any questions come in just yet. And I'll invite those who are with us today to add your questions to the chat box, and we'll make sure that Dr. Zito has a chance to answer those through the session today.
Awesome. So now we have a kind of a baseline knowledge of mental health and how it moves across the continuum. Some of the, you know, signs and indicators that might show up as we move down the mental health continuum model. Let's talk about some of the factors that impact mental health. There is no single factor. I know we always like to think, you know, or it'd be easy if there was a single factor that explained mental health and the occurrence of mental illnesses. But it's not, there isn't. And how we like to think about this as the biopsychosocial model. And then I added current events in there because, again, it's a very relevant topic for us, especially within our current context. And current events, of course, does affect mental health. But the main point is that people are integrated biopsychosocial beings, and we need to be treated in a holistic manner. And we really need to look at all those factors to really understand our own mental health, right? We can't just look at, you know, for example, genetic factors, right? They explain some things, but not everything. So here's biopsychosocial model. Again, I won't elaborate it too much, but you know, we have our biological risk factors. We have our psychological, so things like attitudes, low self-esteem, negative thinking patterns, feelings of helplessness. Stress is an important one, and I'll highlight that. Social environmental factors, so past traumas, family issues, lack of support, negative life events, and again, our current situation does impact mental health. And again, I like to highlight stress. Stress is something that we talk about all the time. It's within our vernacular. But one definition, and what stress is essentially a response to situational demands, pressures, events, happenings, whether they exist out in the real world, or if we're thinking about them. That's what stress is. It's a response. And there has been a lot of talk about stress. I think some of you might be aware of the National College Health Assessment. This is a survey that we do with students at our institution and institutions across Canada and in the States as well, this is the 2016 data. We have 2013 and 2019 data. I don't have the 2019 data for Calgary, but I'll show you the data for 2016, and they haven't changed much. But what it says here is that factors affecting academic performance, and academic performance is related to, you can see the definition here, lower grades, reduced grades on important projects, disruption of thesis, dissertation research, or practicum work, and all those things. But what it's showing here is that the #1 impact or factor affecting academic performance or lower academic performance is stress. And this is true for our institution, as well as for all the institutions in Alberta and in Canada, and by a far extent as well. So you can see that here. And then if you look at the top 5, anxiety and depression play into it. And if you look at number 3 and 4 there on the list, those are related to mental health as well. So suffice it to say, stress impacts academic performance, mental health as well. And here's some of the signs and impacts or effects of stress. Not all stress is bad. We do need some stress, but what we should be really aware of is too much stress and chronic stress. And that's kind of what we're talking about here. But again, just to highlight the cognitive and emotional impacts of stress, right? Difficulty concentrating, thinking, memory problems, lack of self-confidence, low morale, anxiousness, feeling depressed, agitated, unable to relax. So again, all those things might play into academic integrity. And consequences of too much stress, I think we can guess all these things. Lower well-being, poor mental health, increased substance use, less sleep, less physical activity, poor physical health, less motivation, less achievement, and increased dissertation and dropout and attrition. Any questions about stress?
We did just have a question come in from Andrea, and I just asked for a bit of a clarification, but you might be able to speak to it. She said, is there any data on educators' performance as influenced by mental health?
Educators as instructors and people like that?
That's what, yeah, that's kind of what I asked her to clarify. Yeah, and she's saying yes, that's exactly what she's asking.
Yeah, so there is very little research on academic or educator or instructor mental health, but anecdotally, I've talked with many professional or instructors and professors, and we know that's a problem. Looking at our own data at U of C, our data isn't too much different from, if you look at disability claims related to mental health, it's not that much different, if not slightly better. But again, regardless if the rates are the same or not, I think it's an important issue. We were actually, before this, we were talking about how academic culture, as a grad student, we're taught to, by our supervisors, for example, that mental health isn't important, or that we should lock ourselves in our office and work on grants and its papers and things like that are important, and mental health is taking a back seat. So, our culture isn't very conducive for mental health as academics or as instructors. But again, our mental health does suffer, right? So that's a good question. So third poll, since the pandemic started, in general, has that affected your mental health? Again, what we want to talk about are all the factors that can impact mental health. So we've talked about the biopsychosocial model and those factors, as well as stress. And then we're really, again, trying to emphasize the current situation and how that can impact mental health. Yeah, so we're getting some stuff across the board, but the biggest is, it seems like that the pandemic has had a negative impact on our mental health. Again, I can see that because of all the things that are happening, at our institution. We had to switch from in-person to online teaching within a week or so. I know for a lot of parents, staying at home, not having childcare has impacted them a lot, and it has impacted me. I have a 4-year-old, Lexi. She's amazing, but she demands your attention. So, again, productivity, work, So there's a lot of things to juggle, extra stressors, right, for sure. So I can see why, for some that has impacted their mental health. And we're seeing this as well in the literature, mental health. So we're talking about a second wave of mental health devastation. I think they're really, the messaging is quite negative. I like to say, we all have that resiliency. We have the coping skills to deal with this. That said, it's a reality that mental health is affected by the pandemic, and in a negative way. And I think that's a reality. So looking at all the factors, situational factors, stress, the biopsychosocial factors, all those things really impact mental health. And the more understanding we have all those factors, I think, again, the more we can appreciate how mental health impacts academic integrity and vice versa. So again, that's essentially what I've said here. Again, we talked about mental health. We've talked about the factors that impact mental health. So now we have an understanding of this. We can move on to a kind of a discussion about academic integrity and how that's related to mental health and how they're related. Again, there isn't too much literature on this, but I think we can have quite a good discourse or discussion on this based on some of our personal experiences. I've gone through the process with some students, and again, I can see why mental health might be affected by that. And again, we're going to talk about that from the perspective of students first, and then we'll talk about this with the perspective of instructors, faculty, and staff as well. So we want to get both perspectives in there. So what are some reasons that we engage, or students, for example, might engage in academic misconduct? And I know, Sarah, I'm sure you have lots, all the reasons, but just from the chat, are there people, what are some of the reasons that you've heard of or experienced?
Yeah, I'd love to hear from folks in the group chat for sure. But in some of the literature I've read, stress comes out as well. Sometimes it's ill-defined though, but also students lacking study skills such as time management that then can increase their stress. And sometimes the stress can lead to poor decision making. So yeah, I think stress comes into it, but I agree with you that there's multiple, sometimes competing and overlapping factors. And we do have some input here from the chat. So we've got unclear expectations and procrastination. If they think other students in the class are doing it, then they feel that they will be disadvantaged if they don't engage in academic misconduct as well. One person's reported because they can, and then low self-confidence has come in. So we're getting a variety of input here. Thank you for that. And then one other's come in of lack of understanding about citations, not understanding when an assignment is open to group work, not understanding the lesson, poor teaching. This is the whole gamut here, and fear of failure. I think that's a really big one as well. So yeah, lots of great input. Thanks, everyone.
And again, there's a range, like Sarah was saying, there's a range of different factors, but mental health does play into it, stress does play into it. And here's one article that I read. It talks about I don't know if anybody's come across this article. It's quite interesting. It's from the University of Manitoba, but it talks about they do interview experts as well, but they talk about the student, specific student's experience. Alex is that student's name, but they went into a quiz, and Alex wasn't prepared, and Alex copied from a friend's quiz, and they got apparently they got the same questions wrong, and they got them wrong in the same way. So then the professor flagged that, and basically his reason was that I think his or her grandparent was sick, and then there was also major disruption when Alex's partner or girlfriend, I think it was, they broke up. So it was a really steady relationship or a committed relationship, and they broke up. So both of those factors really led to Alex's not being prepared and studying. So again, these are some other factors that might impact life circumstances, increases, this life circumstance, increased stress led to Alex cheating. So again, lots of different factors. Poll number 4, have you noticed changes in instances of academic misconduct since the start of the pandemic? So I'm really curious to see, what people's, especially from other institutions. Okay. I don't know if that's what you expected, but I think that's what I expected as well. So there, yeah, again, there's actually more and a lot more. So about 55% say more, a lot more. And I don't know if there's any actual evidence, but anecdotally there is evidence. And Sarah, you were quoted in this and talked about it. But Dr. Barker, who is the Vice Provost Students Experience, keeps the stats on this at our institution here at UCalgary. And what she says is that she did notice a little bit of a increase, but it could be due to the procedures and really actually the changes in procedures. But at our another institution at Mount Royal, they actually seen at least a doubling of cases of academic misconduct, since the pandemic. So it's interesting. Again, it's interesting that people are saying that there is more and a lot more actually. So, sorry. One thing here that was mentioned in this article was that some of the possible impacts are, the online environment for sure. That for sure it could be an opportunity to that increases the amount of academic misconduct that we're seeing right now, but also stress, right? That was another thing that was mentioned. Students are stressed out by, for example, the change from in person to online. This is a different way of doing things. Anecdotally, I hear that students are experiencing a lot more of a workload as well. And from talking with my students, I don't know if this is true, but anecdotally, they're saying that for compensating for online, using less exams and more assignments, and assignments take more time. So again, added pressures, increases in workload, all those things might impact how students' decision-making and could lead to academic misconduct. In other words, things like cheating or copying off other students. So again, what we're trying to do here is really talk about the link between mental health and academic integrity. Sarah, I don't know if you can add any more into this, but these are some of the citations that Sarah sent me. And yeah, there isn't much research, but what the research is saying is that stress, anxiety, depression are related to attitudes towards plagiarism. The more stressed, more anxiety, more depressed, the more positive attitudes towards plagiarism. Stress is one of the biggest motivators or primary motivators for cheating. We also see that there's a relationship, the improved mental health relates to less cheating as well. So again, that's what the research says. I don't know if you had any other thoughts on this, Sarah, but again, the research isn't too big on this, and that's what it does say.
Yeah, I agree with you, right? Having looked into it a little bit, we can see that there's discourse starting to emerge, and there is some empirical research that's starting to come out, but this is a new area for sure, is to connect these links. And in some studies, it's been mentioned tangentially to maybe a primary research question or an accidental finding, but people who have gone out like Tyndall and Curtis in Australia, who have really sought to do empirical research on exactly this topic, is definitely an emerging area. And so we're learning more and more all the time that the connections are there, but we've yet to have a strong and robust body of research to show how it impacts students on a broad scale. We did have a question come in, if you'll entertain one. Amy's asking, how does self-esteem and academic integrity intersect? So what's the relationship there?
So I think the relationship is that if there is lower self-esteem, then there is probably maybe an increase in academic lack or less academic integrity. So, self-esteem is quite integral to, our being, but self-esteem essentially is our sense of self-worth, right? If we have lower self-worth, that might be related to feeling less competent or feeling less self-efficacy. So that might be related to engaging in more academic dishonesty. I don't know if that's, I haven't read any research specifically on that, but that's how I would view that.
That actually leads me to a follow-up question, because sometimes in the academic integrity research, we'll see that one of the factors that can sometimes contribute to student misconduct is parental pressure. And if parents are putting pressure on their children to get good grades, and particularly if grades are an indicator of how much parents value their children. So the higher grades you get, the more I love you, that kind of messaging, it has come through in the research that can be a real driver for students' decisions if grades are so important to them that the only way they can please their parents is to get grades, and they'll do anything to get those grades. That can sometimes lead to misconduct behavior, not because the students want to cheat, but because they are desperate to have the love and affection of their parents. And I wondered if, like, we've seen that in some of the academic integrity literature, but, as we talked about those factors, like there's students and there's the university, and then you talked in one of your slides about trauma. And I wondered if that was a kind of trauma, or maybe it's a social impact that can have an effect that we as members of the faculty might not see in our students.
Well, and actually that's a great comment, and we see that, and I'm going from kind of experiences, but from a lot of international students, parental expectations is a big factor in a lot of the things that they do, right? And students here as well, expectations and influences from parents is integral to our mental health as well, right? And I think you're correct in signaling that parental expectations will impact the choices that students make. And if parents place kind of undue expectations on students, and if the student really values their parents or needs that love and affection from their parents, then they probably will do anything to try to meet their expectations and gain that love and affection. And if cheating is one way of getting there, then maybe that's a reason why they'll engage in that, but not because they want to be, like you say, dishonest, but it's to meet that expectations of that parent. So that's a very, very important factor. Yeah.
We had one more question come in, if that's okay. Sure. It's from Renata, and she's asking about competition, and does competition play a role in any of this? I see you're nodding your head. I'm interested to hear your thoughts.
Yeah, and I don't want to signal out any specific groups, but I think there are some professional faculties, for example, that are that's within the culture is competition. In other faculties, maybe less so, but I know in some specific faculties, competition, doing well, and that comes at the cost of others. So, I can imagine that there might be more academic misconduct within some of those. Again, it's the pressure within that culture to do the best you can. And, it's do anything you can to reach that goal of being the best. So, again, it might be not, the intention might not be to be dishonest, but to achieve that, goal of being the best. So that's a great thought and great question. Yeah. So again, mentioning mental health and academic integrity and really talking about this isn't to give students excuses for, engaging in that academic misconduct, but I think the better we understand the issue, even talking about all the different factors, we can really think about, so competition, parental expectations. If we understand those factors, maybe we can address them in better ways, so then we can reduce academic dishonesty. So how do we start addressing this? Again, we've mentioned some of the factors, but what are does anybody have any thoughts on how we might be able to address some of these things, issues and factors that we've raised already in our discussion?
Maybe I'll start by sharing a comment from Crystal here, and she said, as a former academic advisor, she said she saw more students who were afraid to talk to their professors or to let their parents know how stressed they were, and it was hard to get the students to talk to them. And this may be like maybe this is how a student's feeling, but they're not sharing those feelings with either their parents or their prof. So that's not really a question about how do we start to address it, but it does sort of unpack some of the multiple complex factors that are coming into play with students' experiences.
Well, and we've done we're starting to do quite a bit of research on the intersection of teaching and learning and mental health. And, even within the past, I would say about 3 months, there has been about 3 or 4 studies that we've done or that I've heard of through especially grad student research that how do we talk about mental health in the classroom is if professors, for example, are that role model. If they start to talk about mental health within their classrooms, then that will open up discussion, right? Reducing stigma, making it open and free for everybody to talk about mental health experiences is one way where we can, again, if we have mental health problems, then we are more likely to seek help. And this, again, could impact or one of the factors that impacts academic integrity. So, what we're hearing is that if we have professors, for example, in their classrooms, just take 5 minutes at the beginning of the course to talk about it, or show resources, or to acknowledge that mental health or mental illnesses in the classroom, students really do appreciate that through our research and through what we're hearing from other people's research. So that could be one way to do that. Again, may have that indirect impact on academic integrity.
Yeah, and I agree with all of that. We did have a couple of ideas come in here from folks who are joining us. And Jill suggested that one way to start addressing this would be to build self-efficacy, believe in them, students, when they can't believe in themselves. Yeah. And we've had a few ideas, another one from Irene coming in saying, check in with students, share resources, be flexible and responsive. So I'll give you a chance to comment on those, and then I've got a couple more that have come in.
Yeah, and self-efficacy is a really great one. And that's, through our campus methodology strategy, that's what we've been doing is to give students and faculty and staff in general better self-management skills, coping skills. So again, so that students and our campus community feel more efficacious. And again, through that indirectly might impact academic integrity or academic dishonesty, for sure.
And Valerie's made a comment, she's here about building relationships and community and a sense of belonging. So I wondered if you would have some thoughts on that.
Yeah, and that's one thing especially now that is quite impacted is being online. I think we're losing that sense of community, that disconnect, not being able to meet up with friends or your classmates or your colleagues. We're losing that connection. And I think having a sense of community, having ties to, whether it be the classroom or to U Calgary or to your post-secondary institution, really increases, I think, or might lessen somebody's propensity to engage in academic misconduct, right? Having responsibility, feeling tied to that community might make you a better, I guess, citizen of that community and act in more responsible ways. So I think having that tie is very important. And within our context currently, having that disconnect and having that lack of sense of community might actually increase that academic dishonesty that we're seeing in other institutions. So yeah, that's a great point as well.
Yeah, and that segues really nicely into Scott's comment that's come in, and he's opened a bit of a Pandora's box because he's talking about smaller class sizes are needed. He's saying that things that are talking about cannot be effectively transmitted in his class of 360 students.
Yeah, and I agree. I'm not the expert on teaching and learning in that sense, but I can see how smaller classrooms can increase that sense of community. If you're in a classroom of 400 people, you're just one of the numbers, one of the people sitting in the seats there or viewing from Zoom. You don't have that intimacy with the instructor or the ability to chat or get to know the instructor. So I think in those contexts, it might be very important for instructors to set that example, to create that caring, environment, to talk about mental health, so that, people feel at least that this professor is willing to talk about it and create that atmosphere.
Okay, maybe we'll have one more here and then we'll let you go on with your next slide. Now, it's a comment from Amy, and she's asking about, the impact or the possibility of changing assessments away from grades towards competencies. And I know that's another big Pandora's box. And I wondered if you could maybe offer some high-level thoughts on that.
Yeah, and thank you for giving that preamble. That again, I'm not an expert on this, but thinking about competencies, I think, is a different way of doing things, and I think very, very important. At a high level, I view academic success as acquiring knowledge. Getting good grades is one thing, but also being competent in how we navigate situations, how we navigate resources, how we interact with individuals. And I think through our mental health strategy, I think that's what we're teaching students as well. So I think being at a university is more than just getting good grades or getting knowledge, but it's acquiring all those other skills and competencies that I think are related to kind of creating a better citizen, I guess.
Yeah, that's terrific. We've had a few more come in, but why don't we let you go ahead with your slides and carry on the conversation later.
But it's great though that we're generating a lot of good discussion. So let's think about the academic misconduct process. For sure, if somebody engages in academic misconduct, they're caught for cheating or alleged for cheating, they go through the process. This is an additional stressor, right? I don't know if anybody has gone through this process with a student or been witnessed or was part of the process, and you can see how I can see how this can impact the mental health of a student going through this process. And what are some things that we can do to mitigate some of these additional impacts, right? Because it is an additional stressor. For sure, we want, if a student engages in academic dishonesty or engages in cheating, for sure, we need to address that. But is this process that they're going through adding to the stressor and negatively impacting the student's mental health? And can we do something to mitigate that? Again, so maybe we can hold that thought and I'll move on to the next slide here. So here's actually our student academic misconduct process. And maybe we can use this as an example. So, these are the steps that I've outlined in order, and they're kind of truncated. So you're not going to see all the steps there, but essentially a student receives a letter from the dean alleging that they've engaged in academic misconduct. There's a meeting with the dean, and the student is able to respond to the allegations. The dean reviews all info and decides and makes a decision. If there's academic misconduct, there's an indicator applied to the student record, lets the student know, typically within 10 business days, but sometimes it could be longer or shorter. And no misconduct, then the student is acknowledged as soon as possible. But again, we don't know exactly when. Further investigation lets student know that within 5 business days that there needs to be more investigation. And then student may apply if they're found to be have conducted academic misconduct. They can appeal through the student academic misconduct policy. So this is one process that our students go through. So think about that. Are there any potential impacts on student mental health? What are the factors that might impact the student's mental health, right? Or other factors beyond the process that may impact the student mental health, right? Timing within this process, the current situation, personal factors. So we talked about some of those. So are there any thoughts on any potential impacts on student mental health of this process and some of the other factors that might impact this as well?
I'll let others chime in on this, but I wanted to pause on a comment that Irene shared because she's had an experience that I've had. And you mentioned here that the student receives a letter from the dean, and that assumes, of course, that the instructor has gone through the prescribed process of reporting it up. So in that case, the first time the student might hear about it would be from an official letter from a dean or their designate, right? An associate dean.
Yes.
But Irene's had an experience here that I've had actually. And she said she's witnessed many students in her office break down under an allegation of plagiarism when the issue was a lack of knowledge and not an intention to cheat. So the student is confronted and then they'll react with, that wasn't their plan. They didn't know what was going on. And so there's this like sense of shock and breaking down and crying. So she shared that. And I wanted to highlight that because she said it's happened many times to her and it has happened to me as well. And I think it's not terribly uncommon for some students. So I wondered if we could pause on that.
Yeah, and I think, I think ideally when students, for example, when we're talking about studying for a paper, ideally students, when they get to an advanced class, that's at for example, at the 400 level, they have all the skills to cite properly and they understand what plagiarism is. But I suspect that, the courses don't build on each other until the end where, at the 400 level, you're expected to know that, but I don't think students get that knowledge. I think there are some programs or departments that do that, but I think there are departments or programs that may not give the students the skills, so they scaffold into the later 400 levels where they're expected to write a paper and cite things properly. And I don't think they have that knowledge to do that. So I agree. So that is another factor.
And Valerie's chimed in here with a comment, and I'm not sure which school Valerie's from, but she said, they have levels of misconduct, which can allow students who have infractions at lower levels to receive assistance and instruction and education so they don't make the same misstep again. And I think we have similar things at the University of Calgary under the sanctioning procedure, the workshops and things through the Student Success Center.
Yeah, and so that might be one way to mitigate the impact on mental health is getting students to understand, the process and what's involved. For a first infraction, there might be less, but as things move forward, then there might be more impacts, right? So again, signaling and having clear communications might positively impact the process and impact the student during the process, for sure. And so again, taking into these factors, I think is really important, and understanding the student, where they're coming from, all the different factors that might impact mental health will help us in better supporting the student and making a better decision within this kind of the process. Does that make sense? Hopefully that's the point that I'm trying to get through here. Well, I think we'll just skip that, but essentially what we talked about is reviewing through a mental health lens. So policies, processes, and procedures. So actually, this is a chapter that comes from a compendium. I don't know if people are aware of the national standard for mental health and well-being in post-secondary students. I was actually part of the technical committee that created the standard, and it was just launched on October 7th. So hopefully post-secondaries across Canada will adopt this. But there's a chapter that really talks about looking through policies, or looking at policies, processes, and procedures through a mental health lens. And essentially that's what we did here, right? Is to look at a process, understand all the factors, think about the principles and values that we want to look through this policy, and examine the policy and identify some of the impacts and how do we address it. So essentially that's what we did through our discussion here, is to review a policy or process or procedure through a mental health lens. So kudos on doing that, right? And again, what I want to do is just again, highlight the impact of mental health on the academic process and vice versa. I know we're running out of time, so I just want to move on to this process on staff and faculty. And has this process affected you in a negative way?
Are you inviting questions or answers in the chat? Okay.
For sure. And I know I've done this a couple of times, and even related in the student non-academic misconduct. I've been involved in many of those processes, and I know going through the process weighs on me in multiple ways. So I don't know if people have any experiences with that. And maybe we'll just throw up the poll as well. So what aspects were most impactful or going through that process? What has been impact for you? So I can click off. So again, I welcome comments or completing the poll. Yeah, wow, actually the top 3 ones were all selected. So going through this process does involve extra workload, extra stressor. There's an emotional impact in this, in the sense that it weighs on you negatively, right? And does impact your relationship with students, especially in circumstances where, I've had this happen within, rather than a course that I taught, it was within kind of more of an independent studies context. So I knew that student quite well. And, I wondered, how this would affect my relationship with a student as well. So yeah, it impacts us in multiple ways. And it's an additional stressor for sure going through this process. I don't know if, I'm sorry, you had any additional comments from?
I don't have, we've got a few comments here that it takes a lot of time to follow all the processes, and faculty were very stressed about the integrity of their assessments during the pandemic because it was a high stakes at the end of course assessment. So that there are stresses on faculty in terms of teaching and assessing during the remote. It's more than a pivot now. This is our new normal, but to acknowledge that there's stress for students and there's stress for faculty as well. Yeah, and as we're talking about this, I was also reminded of an article written by Katie Crossman, who is a sessional and writing from a sessional perspective about being afraid that if she reported misconduct, she might be pegged as a troublemaker and not get offered another sessional contract. So the impact to a possible impact to employment for the precariously employed academics is something that seems to be only just starting to be discussed in the literature.
So again, I think it's important that we, bring up all these issues and concerns and impacts on mental health in general, so that we can address it. Hopefully we can, this is just a starting point, and we can devote more time in discussing this in the future. But I think you can see that, there is a relationship between mental health and academic integrity, and that this is a starting point. We need to discuss it a little bit more. So I do want to really just talk about resources, because again, we talked about mental health, we talked about the factors, and we talked about the relationship between mental health and academic integrity. But I think it's always important to talk about resources, whether you're working with a student who is beginning in this at the beginning of this process or in the middle. Students might get distressed. We talked about students that might break down and cry in your office, for example. But even our own mental health, we need to really monitor and address that. So understanding the resources that exist will be very, very important. So again, I just want to, we won't go to the poll, but I want to highlight the main resources that we have on campus in the last 3 or 4 minutes. Student wellness services is the go-to place for student mental health. And here are the contacts, right? The website is very informative. We have the contacts there. They are actually open and in person, but they are still also doing things virtually as well. And here are the mental health services that are offered at Student Wellness Services. Again, here's the gamut of all different, right? They range from the spectrum of less intensive to more intensive. So I want to highlight here a single session. That is something new. So this really helps students get the help they need sooner. So before they would go to triage, then they would make a second appointment to see a counselor. But now they get the triage and the initial counseling at the same time. So then that speeds up the process. If students do need further counseling, then they would continue on. But again, most students actually just need the single session. About 50%, that's what we're hearing, of students only need one session. That's enough for them to help with their problems. I also want to identify here student at risk. So you can email student at risk or phone the number, but if you are aware of a student who you think is at risk of, whether it's self-harm or in distress, that is one place that you can contact. And if you leave a message, they get back to you very, very soon. If you're just curious, or not curious, but if you're concerned and don't know how to proceed, you can ask for a consultation. So that's a very important number for all faculty and staff to understand and know. Helping students in distress. This helps you identify when there might be possible distress and how to talk about it and make a correct referral. So this is a very, very important resource. And this is the second page of that resource with all the resources that are there and how to make a good referral. And here's the resources for faculty and staff. Staff wellness is our main resource for faculty and staff, mental health and well-being. I want to highlight work, life, and well-being in the next slide, but we have a mental health consultant. This position has been around for a couple of years, but it doesn't really exist anywhere else in any post-secondary. But you can call up Amy and she will be happy to consult with you on your own mental health. If you have a colleague or somebody that's in distress, or you're a manager and you want to know how to handle things, then Amy is the person to call. And then our wellbeing work life, again, offers various mental health related workshops. There's a wellness advocacy program, various guides and tools, EFAP, we have counseling in various modalities and various online resources. So please access those and look those up. Campus Mental Health Strategy website is a very important website with all the resources. And YouFlourish, if you're on our campus, please attend YouFlourish. And for those who are off campus too, these are open to the public. 70 events. The address is right there. And that's it for today. Thank you. It was an awesome discussion. Awesome to get to chat with you about this important topic. Again, more discussion is needed for sure. And I think this is a good starting point for that.
And I notice we are exactly the top of the hour. So thank you for your impeccable time management, including fielding all of those questions. And I just wanted to thank you so much for sharing your expertise and wisdom with us. You've opened up a super important dialogue around the connection between academic integrity and mental health. Thank you again. So appreciative of everything that you shared with us today. Take care.
Yeah, thank you.